Hi, I'm Dr. Ninh Tran, and I'm the Medical Officer of Health at Southwestern Public Health. I want to take a moment to talk to you about staying up to date with your COVID-19 vaccines. First, let's look at how we got here. In 2019, COVID emerged as an entirely new strain of the coronavirus that immune systems did not recognize. And by 2020, COVID-19 was declared a global pandemic. This led to a lot of illness that overwhelmed our hospitals, and there were many deaths. It also resulted in significant work absenteeism and interruptions to business, education, and the economy. So public health experts around the world recommended strategies to prevent further spread as we learned more about this virus. Through global efforts, vaccine developers were able to access research that would normally take many years to gather. This led to one of the fastest global vaccine rollouts in history, but without sacrificing research quality. What was not expected was how quickly the virus would change or mutate. These variants have similarities to the original strain, but they're different enough to cause reinfections that sometimes lead to serious health outcomes. Through a combination of vaccination and natural infection, our bodies have a blueprint now of how to fight COVID-19. However, the effectiveness of this protection fades or wanes over time, especially for symptomatic infection. Many health experts have found this occurs around 5 months after your last vaccine or infection. Far less time if you are elderly or immunocompromised. This waning or fading effect is not uncommon in the vaccine world, which is why some vaccines need boosters or repeated doses. I know you've heard a lot of changing advice over the past 2 years. This is to be expected with a new virus. As we learn more, we update our advice. Health experts have now recommended more doses than the original 2 that were once considered fully vaccinated. Canada's National Advisory Committee on Immunization and Ontario Science Table both advise boosters to keep your level of protection high. So the key message here is not to let too much time pass between your last dose and any boosters you're eligible for, especially if you're 60 and older, immunocompromised, or belong to a First Nation, Inuit, Métis population or household, as you are at higher risk of a serious COVID-related illness. If you've just become eligible for another dose, try not to let too much time pass between your last dose and your next one, especially if you are in regular contact with one of the higher risk groups I mentioned earlier. I also ask that you be open and adaptive to changing guidance and formulations as experts learn more about this virus and its mutations. We've all enjoyed the return to normal of the past several months. Let's not take that for granted. COVID-19 is still with us, and in fact, cases are rising. Your immune system may need a boost to prevent the kinds of infections that could land you in the hospital. So please, stay ahead of any future surge of cases this fall. Visit one of our many clinics, talk to your family care provider, or contact a local pharmacy to get vaccinated. Thank you, and have a healthy summer.